Hi, my name is Shannon Young, and today I will talk to you about evaluating secondhand smoke exposure in sudden unexpected infant death to drive prevention efforts. We will discuss the background of sudden unexpected infant death, infant mortality, and how secondhand smoke has been shown to impact sudden unexpected infant death. And then we will also discuss the specific problem as it presents itself in Rhode Island, as well as the proposed solution, and then the conclusion of how this solution would impact prevention efforts in Rhode Island. First, let's get a baseline understanding of sudden unexpected infant deaths, otherwise known as SUID. SUID is the sudden and unexpected death of a baby who is less than 1 year old. The cause of the baby's death is not obvious before the death, and these deaths often occur during sleep or are related to the baby's sleep environment. Let's review some data to give us some context about infant death in Rhode Island. First, let's look at the broader topic of infant mortality. Rhode Island has an infant mortality rate of 4.0 deaths per 100,000 live births. This is one of the lowest infant mortality rates in the country, but still not quite as admirable as the rate in nearby Vermont, which is the lowest in the country with a rate of 0 deaths per 100,000 live births. Now let's turn our focus specifically to SUID. From 2016 to 2020, Rhode Island had a SUID rate of 86.2 SUID deaths per 100,000 live births. The next closest New England state was Connecticut, with a rate of 60.5 SUID deaths per 100,000 live births. Rhode Island has the highest SUID rate in New England, and this shows that although the overall infant mortality rate in Rhode Island is relatively low, Rhode Island has an exceptionally high SUID rate when compared to every other state in New England. There are many factors that contribute to SUID, such as the infant sleep environment, exposure to cigarette smoke, parental alcohol and/or substance use, and the health status. Studies have shown that 1/3 of SUID cases involve in utero smoke exposure or maternal smoking, and maternal smoking and secondhand smoke exposure are the most modifiable risk factor in SUIDs. Currently, Rhode Island SUID prevention efforts focus on safe sleep environments with multiple different programs listed on their website, and there is only one single mention of smoking cessation services on the same website. So the problem is, since we know that Rhode Island has an elevated SUID rate and that secondhand smoke exposure is the most modifiable SUID risk factor, it would make sense that it would be a priority to understand whether or not smoke exposure occurs frequently in the context of SUID in Rhode Island. Unfortunately, this data is not currently available with the existing protocols. So the current medical examiner protocols call for a scene investigation to be performed for any suspected SUID case. A scene investigation normally includes the examination of the baby's sleep environment, a scene reenactment, and investigators they interview families and they may discuss smoking patterns and habits, but this is typically or often skipped over due to sensitivity during a highly emotional time. I propose adding a protocol change of adding single-use air quality tests to evaluate whether smoke is a factor in each case of SUID. These tests also test for additional substances such as volatile organic compounds, molds, surface dust, allergens, and formaldehyde. There are numerous advantages to these single-use air quality tests. First and foremost, these are a low-cost expense coming in at about $200 per test. The medical examiner's office would need to provide a test for each possible SUID case, and there are about 20 possible SUID cases per year, meaning the expense would be less than $5,000. These tests provide unbiased, quantitative results, which are much more reliable than the current system that depends on already distressed family members to self-report smoking habits. These tests also account for ambient smoke that family members may not be aware of. For instance, people who live in an apartment complex where neighbors may be smoking without the family's knowledge, and the smoke may get into the infant's sleep environment or the apartment. Since these tests evaluate for several substances, they would also provide additional data for analysis on the role of these other substances in the context of SUID if we determine we want to examine that data at a later date. In conclusion, Rhode Island has a significantly higher SUID rate than any other state in New England. Smoke exposure is the single most modifiable risk factor associated with SUID, and Rhode Island does not currently collect data on the presence of smoke at the scene of a SUID. Implementing single-use air quality tests would provide data on the influence of smoke exposure in SUID cases in Rhode Island. Data gathered from these tests would inform the need for SUID prevention strategies addressing smoke exposure, and air quality testing would cost less than $5,000 per year. So thank you for your consideration, and here are the references. And thank you very much.